A day of surgery, there's gonna be a million people asking you so many questions, it's gonna make your head spin. You're gonna be very confused, it'll be disorienting. You're probably gonna meet around 15 to 20 new people that you probably won't see much ever again. So you can expect to have a lot of questions. You can expect that people know that you're nervous and they're here to ease that discomfort. They're here to help you. So make sure that you're asking questions. Make sure that you're staying engaged with those people, because all of them are really here to make sure you have a great experience. And they know, because this is what we do, they know that you're nervous. They know that people are asking you a bunch of questions. So just try and keep that in mind. Stay patient. Try and be positive. And if you're scared, tell people. Say, I'm nervous.
For any surgery, the patient has to stop eating and drinking at midnight the night before. You want at least 8 hours of nothing in your stomach so that during the anesthetic process, you're not likely to cough up anything into the lungs. Number one, you're asleep for the surgery. That's a question almost everybody asks. It's either a general anesthetic where they have a tube down your throat to keep you asleep, or they do a spinal anesthetic where you essentially numb the body from the hips down and then just do sedation. So either way, the patient should not be aware of what's happening.
A lot of our patients will go through these surgeries with getting numbed up from the back, so they'll get a spinal anesthetic. They get numbed from the waist down, and then once they're taken back into surgery, they're given medications. Most of them prefer to take a nap while we do these types of surgeries, and so they're numbed out, they're taking a nap, and when they wake up, they're not coming out of the fog of general anesthesia, so typically they have less nausea, they wake up quicker. Because of the spinal, they don't have pain right away. A lot of times we'll also do peripheral nerve blocks where they'll actually go in and numb out some of the nerves in the legs, so you wake up, and even once the spinal wears off, a lot of times we'll get 12 to 24 hours of very minimal pain after surgery.
With any surgery, we have to make an incision. We have to go inside the body to start working on things. So with a knee replacement, for instance, it's typically about a 6 to 7 inch incision, give or take a couple of inches, depending on the patient's size. And we go through the skin. We then divide the muscle around the kneecap so that we can literally flip or invert the kneecap, bend the knee, and that gives us access to the entire inside of the joint. You then have to remove the diseased cartilage, what remains, the hardened marble-like bone, the new bone spurs that have formed, and do so in a way that leaves the leg aligned the way we want. And so we use specific instruments to measure all of our cuts so that we can take off all that diseased bone and cartilage. And then we cement in place the new metal implants that have been measured, obviously, to size match the bones of this particular patient. And then we have some versatility with the plastic. It's a polyethylene. It's a very unique plastic that doesn't wear out very quickly and is very smooth. It gives very low friction to give you a smooth hinge joint, and we are able to pop that into place and different thicknesses of it, essentially to control the stability of the knee. So when all is said and done, you want a knee that is aligned the way we want it in the natural kind of 5 degrees of knock knee that is stable side to side and full range of motion. That's what we're looking to establish. Then it's up to the therapist and the patient to keep it that way.
Typically, a knee replacement ranges anywhere from an hour and 15 to an hour and 45 minutes is pretty typical for most surgeons. Hip replacement probably falls pretty much in the same realm, about an hour and 15 to an hour and 45 minutes. Some people have worse arthritis, deformities that we have to correct. Sometimes it takes up to 2 hours, but commonly that would probably be the upper end of what it would take to go through a surgery like this.
For hip and knee replacement patients in my practice, there's a lot of preparation. We make sure that we address all of their medical issues and make sure they're optimized medically so they can be the best version of themselves before surgery. We make sure that they don't have any issues with their teeth or their dentition. If there's any active infections in the mouth, having a new hip or knee replacement with an active infection somewhere in your body could lead to a bad outcome. We also make sure that they have a good system, a home support system, so that after the surgery, they are successful. We don't want to just operate on people and kick them out the door. We want them to leave safe. Patient safety at home is very, very important after surgery. So we do a lot of work with our patients to make sure that they have those things. Infection prevention is very important. We give them special soaps to use. If they have anything in their nose, any type of colonization or bacteria in their nose, we make sure that gets cleaned out to really prevent infections in the future. We do give them a nice course that Claudia Happy puts on, and we make everyone go to, because it talks about things to do at your home to prevent falls, things to do at home to prevent infection, like changing your bed sheets, new clean sheets, making sure that if you have animals, especially small animals, running around your house, that they stay clear of your feet when you're in the early post-op period so you don't trip and fall and get hurt. So there's a lot of things that we really do. It's a whole process to set people up for success.